You see, while describing the chronic pathology, I have mentioned this spongiosis. In chronic pathology also, there is a chance of accumulation of the spongiotic lesions in the histological level. That is why in previous class I explained that in chronic case also we should consider the Samsana initially. You will be remembering that. You will be remembering a question asked by someone. Why we adopt the Samsana in chronic cases also? We can whether we can go directly to the dosha shamana treatment. You see, in the case of chronic pathology, there is a chance of spongiosis. So while we apply an irritant ointment over the area, the chance of aggravation, chance of triggering that inflammatory globule is persisting. So that chance should be eliminated. The chance of triggering that inflammatory globule under the skin should be eliminated by addressing the spongiosis first. That is why we are adopting a Sramsana treatment or Virajana treatment initially. You see, it's a main theory. In physics, we can see a theory, osmotic theory. Osmotic theory means when fluid drains from the central portion, the fluid from the periphery drains into the central part. When the theory is very important. When fluid from the costa is eliminated or purgated, at that time the fluid from the shakha comes to the costa. You see, every togrogas, the skin manifestations are the peripheral lesions. Peripheral lesions means the shakhagata vigaras. If from the shakha, the inflammatory or the aggravated pitta dushti or tishna ushna gunas of pitta, the aggravated the dushta doshas, that should be drained back to the costa. So actually the accumulation should be eliminated by the Snehavana process, but the negative force created in the costa will drain back the fluid accumulations from the periphery. That is a initial triggering force we are creating from the costa. I think you are getting my point. From the costa, initially we are doing a virajana with Avibhati Churna, Padalamudari Churna, like that. So while we are doing a virajana internally, there is a chance of draining back the fluid from the periphery. So in every lesions, basically from the acute to chronic, while we are doing a Sramsana or virajana, we are trying to drain back the triggering force in the shakha. Triggering force in the shakha will be drained back to the costa with the process of Sramsana. You see, in the case of chronic case also, we are doing a Sramsana initially. After that, we are going for the other treatment. You see, in the case of thickened fibrosis, dominant granulations, these are the very relevant pathology happened in the chronic pathology. So in chronic pathology, after doing a initial shodhana, initial Sramsana, not a proper shodhana means initial Sramsana, Pajana, Devana, we are advising Snehavana in chronic cases. In chronic cases, Snehavana is very relevant because this Snehana is intended to do active circulation, smoothen the granulations, fibrinolysis, keratolysis. This you see the smoothening of the granulations and fibrinolysis, keratolysis. The three main processes are activated by the process of Snehavana. Snehavana, that is Snehana, the Sneha gunas of the medicated ghee acts upon these factors that soothes the granulations and that does the fibrinolysis and keratolysis. So you see, these are the external therapies, your topical therapies we are mostly adopted. You see, this is a wet compression. Can you see this video?
Yes, sir.
Yes, sir.
We are able to see that. Sir, now it is not working. Previously, it started to show. Sir, I think you can just click on it. Yeah.
Now can you see?
Yes, sir. Yes, sir. Yes. Yes, sir. We are able to see that.
In wet compression, we are using can you see this? Have you seen this? Hello?
Sir, that video is playing, sir, playing very well. But during that video, your voice is, hearing is broken only, sir. So the audio part is not clear when along with that video, sir.
Okay.
I think after playing that video, you can
Okay.
explain. Sir.
Okay. Now you will. Okay.
Sir,
Okay.
now both the
Okay.
thing is going well, sir. You can explain it, sir. Thank you, sir.
Okay. In wet compression is a very effective topical therapy. You see, in this case, we are keeping a kashaya, which whatever may be the kashaya. With that kashaya, a cloth piece is dipped in the kashaya, and with that cloth piece will be put on over the area, mainly in eczematous lesions with the discharge and virulent discharges and bloody discharges. If we do a wet compression with the type of some kashayas means Triphala Kashaya, Guruji Kashaya, or some whatever may be the Kashaya, that we can select that. And with the Kashaya, we are dipping that cloth piece in the Kashaya, and after that we are putting that cloth piece over the area for some time. For some time means um, uh, um, 10 seconds or 20 seconds. And after that, we are taking that cloth piece, and again we will wash in a fresh water. And after that, we will put in a kashaya and put that upon that area. Like that, if we are doing that process, then the wet compression will do a mechanical cleansing from that area. That is an antipruritic therapy, soothing, decongestant, prevention of decay of tissue, facilitates drainage, vehicle for medicines, opening of blisters, keratolytic, softening the crust. You see, by doing the process, the purulent discharges and the crust over that area will be attached to the cloth piece, and by doing the washing in fresh water, we can purify that cloth piece, and after that, if you put in kashaya and doing again that wet compression, if we advise this therapy to patients, it is not necessary to do in IP as an IP management. We can do advise the patient to do from their home. If we advise this therapy, they can the intense pruritic lesions and intense infected lesions. In all these cases, this therapy is very effective because they are getting instant relief from this wet compression therapy. So this is a modern modality, but we can adopt this wet compression by using Ayurvedic medicines. So we can utilize this topical therapy very effectively. This is a occlusive bandaging, mainly for the skin. In patients with dry skin, you see, after putting their area in a kashaya or any water medium, any water.
Hello, Madhu sir. Sir, I am interfering in between. Sorry, sir.
Doing a
Sir, sir, I think. Excuse me, sir.
without
Hello, Madhu sir. Sir, Madhu sir.
drying that area.
Hello, sir. Excuse me, sir. Sir, Madhu sir, am I audible, sir?
Hear me?
Sir, during the video, sir, your voice is breaking, sir.
Am I audible?
And no, sir. There is so much disturbance in your voice, sir. Sir, while playing that video, your voice is breaking too much, sir. Sir, I think first you can play the video and the delegates can watch them. Then you can explain it, sir.
Yeah. Okay.
Yeah, sir. Together, it is disturbing your voice, sir.
Can you see this video?
Sir, videos. Actually, video stopped now, but the video is visible only, sir.
Audible. Can you see this video?
Yes, sir. Yes, sir. It is in a pause mode, but yeah, sir. That will be better. Yeah, sir. You can play it first, sir.
Okay. Okay.
Thank you, sir.
Have you seen that video? Okay. 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 You see video. Okay. Can you hear? Hello?
Yes, sir. Yes, sir. Now, yeah,
Hello?
yes, sir. Yeah, wait. Yes, sir. We can hear you, sir.
Hello? Okay.
Hello. Yes.
We have seen that occlusive. Okay. We have seen that occlusive bandaging. Occlusive bandaging if, is done mainly in dry skin. You see, in in the case of dry skin, usually we do a wrong practice because in dry skin we apply oil and after that we will wash with soap and all. It is not a proper treatment. In dry skin, you see that is dehydrated skin. Dehydrated skin, we should hydrate the skin. We should hydrate the skin. So while doing a hydration, you should not apply oil first. initially you should dip that area, or you should apply over that area some kashayas or watery medium. After that, you should do a protection of that rehydrated area with oil, and after that you should cover it with some polythene sheet or some banana leaf. The banana leaf we are using here in Kerala. In your places, you may use some leaf, some sort of leaves, and after that you may cover that area with a polythene cover and with the cotton and that, like that. This is very, very effective in dry skin, especially in plantar keratitis or hyperkeratitis of plantar area. That is called occlusive bandaging. And medicated baths and soaks are very effective in extensive lesions. Extensive lesions means they very this exfoliative dermatitis and this exfoliated in mainly in all body. Exfoliative lesions will be there. Psoriasis, whole body extent of psoriasis will be there. In those recent lesions, we can do Nalpamira Kashaya Dhara or Tribala Kashaya Dhara, whole body Dhara, or sitz bath or starch bath with poultice. Poultice means starch bath means we are in Kerala, we are preparing a Nyavara Paisa, Shastika Lebana over that area in order to rehydrate that area and in order to soothen or smoothen that area. These are some particular types of occlusive bandaging, protective bandaging, and compressive bandaging. The dressings are done mainly. The occlusive bandaging, we have seen that. Protective bandaging means in some children, they will continuously scratch that area where there is a itching. They will scratch that area continuously, and that scratching will aggravate the lesion there, and a huge lesion will be formed there after continuous itching. In order to avoid continuous itching or scratching at that area, small areas of hyperpigmentation or small areas of itching should be covered with a small cotton piece. That is called protective bandaging. Compressive bandaging is used mainly for the lesions created by the varicose veins. Varicose veins means the lesions created due to the chronic insufficiency of veins. Chronic venous insufficiency will block the drainage from the lower pooling of lower part of the limbs. So for that, we will do a compressive bandaging by which the capillary drainage can be stimulated from the lower part of the lower limbs. These are some fiber materials used for the occlusive bandaging here. And while discussing the topical therapy, I think the special procedures like rectamoksha are also very relevant. I don't know whether the time limits permits me. I think this is the time for discussion. I think if time permits, I will discuss the special procedures like rectamoksha in detail. Otherwise, we will go for discussion parts. What we can do?
Sir, we have 10 more minutes to complete the session.
Okay.
If that is the time limit, then yes, sir. We can proceed till 9 o'clock.
Proceed.
Yes, sir.
Okay.
Thank you. Okay.
So, as far as rectamoksha is concerned, in skin diseases, we are mainly doing prachana, jaluga, and siravetha. The Kuttana or the Suji Vetha also we are doing mainly in alopecia patients. The Sringavajarna we are not practicing for cutaneous manifestation, but some lesions related with the muscular lesions, mainly the lumbago, the muscle spasm related lesions we are doing Sringavajarna. See, this is the I think the in Prachana, in the case of Prachana, you have seen, I think, the scene I have shown there, the Prachana in elongated lesions, elongated injuries are made over the skin where the diffused eczema is there. Mainly we are practicing the Prachana in the case of diffused eczematous lesions. In those cases, the capillaries will be obstructed due to the chronic lodgement of deoxygenated blood. Or the superficial capillaries, there will be dislodgement of non-oxygenated blood. So they will not enter into the mainstream of blood, and that will not be purified by internal medication. So for those patients, it is necessary to initiate a repair mechanism of the capillaries by doing as many as injuries over the capillaries. We should destroy the capillaries externally. By that, the repair mechanism will be activated there, and the healing mechanism will be concentrated on that area of the body. For that, we are doing Prachana Karma, and the Prachana Karma will eliminate the deoxygenated blood from the superficial area, and during the at the same time, the repair mechanism and the healing mechanism will be activated there also. So, by doing elongated lesions, it should not be it should not get in depth. In depth lesions are not necessary. Superficial elongated injuries should be given for the Prachana. During that time, in Prachana, we are doing elongated lesions, and the healing mechanism activates there. In Jaluga, you see a clotted blood. Wherever there is a clotted blood, we should do an anticoagulatory mechanism there. By doing an anticoagulatory mechanism, that blood should be squeezed out. That deoxygenated blood from the coagulated area, that should be squeezed out by an anticoagulatory mechanism. For that, we are utilizing this Jaluga. In the case of Siddhavetha, you see, Siddhavetha is practiced mainly in varicose veins here. There are so many references. So in so many diseases, the Siddhavetha is advised actually. But mainly in the case of varicose veins, we are practicing here. In the case of varicose veins, as told earlier, the chronic venous insufficiency is there. The valves in the superficial veins will be dissected, and in between the valvular area, there will be accumulation of deoxygenated blood in the case of varicose veins. So the patients will be having severe pain or itching in some cases. In cases of varicose veins where there is no pain or itching, it is not necessary to do this type of Safer-e-AIAPGET. Actually, that cases, if we perform some types of abhyanga with some oil, Safer-e-AIAPGET, that will be cured. But in the case of varicose veins with pain and itching, that is due to the accumulations of some chemicals which induce pain and itching there in that area. So in that case, we should reduce the pain with by doing a Safer-e-AIAPGET from there, by eliminating, by draining out the accumulated blood in that segments of superficial veins. For that, we can do Safer-e-AIAPGET with a simple needle or a transfusion set and all. In the case of Kuttana or Suji Veda, mainly in alopecia we are doing the Kuttana. In alopecia, there will be some area where the hair loss occurs due to the accumulation of antigen antibody complexes under the hair follicles. So we are performing a Kuttana Karma or Suji Veda there, and we are revascularizing that area, and the revascularization can be activated by the modality of pricking with the help of a lancet. And after pricking that area, we are also performing a Jaluga with another. From that area, we are draining the with the blood with the help of an anticoagulatory mechanism, with the help of a Jaluga also. It's a type of pradhana. And I think this is not proper. The video is not activated. Dhubana is another type of topical therapy. We are doing this mainly in the case of purulent lesions. Purulent lesions means discharge lesions with discharges. If we do Dhubana with Gulgulu, that is a very anti-infective, anti-microbial Dhubana. With the effect of this Dhubana, the area will get dried up. This is the stages of bed sore treatment. Means that Ulsadana Karma is a particular special topical therapy that can be used for the healing of bed sore with some Shastika. Initially we will purify that area. The Pranashodhana should be done with Nimbagalka and Tilagalka. Nimba and Tilagalka we will use for the Pranashodhana, and Aragodadi Kashaya Dhara we will do. With after Aragodadi Kashaya we will put a Nimba and Tilagalka there. After purifying that Vrana, we will put Shastika along with the Ajamamsa. Shastika along with Ajamamsa we will do, and with that area will be healed. The bed sore will be healed properly. It's a repigmentation therapy. Repigmentation therapy means that area, from that area you see in the case of vitiligo and leukoderma, the dopa negative melanocytes should be activated to regenerate the melanocytes and to regain the pigmentation. After doing internal purification, we are doing Avalkuja Vijaya Churna application, and we will advise to expose that area to sunlight. Gradually, that area will be regained the melanocytes. You see, as previously I detailed that in the case of vitiligo, in the tips and lips, there is no dopa negative melanocytes. So that is why the lips and tips are guhyapanitaloshteshu asadhya. These are not curable in many cases. Some cases, chances of repigmentation is there. Hyperkeratinization, I already described the hyperkeratinization treatment. While describing the occlusive therapy, I have detailed the treatment there. Repigmentation, rehydration therapy practiced for the hyperkeratinization. Rehydration with occlusive bandaging. In eczematous dermatitis cases, we can perform the wet compression very effectively. While doing the wet compression, the crust and discharge, purulent discharge will be cleared from that area, and that Vranashuddhi occurs with the wet compression. This is a verrucous or papillomatous lesion, filariasis case. So, you see, in between the ridges, there will be some particular types of worms, maggots. Maggots will be stagnant inside the ridges, and that will create an intense pruritus. Patient will be having very severe itching. In order to clear this area, we should drain the maggots in between the ridges. For that, we will use some kashayas that contain sulfur also, gandhaka also. So in Arguladi Kashaya or Manjishtadi Kashaya, we can mix with some Gandhaga, and we can use a small type of pump set with a small motor, and we can forcefully pour some Kashayas in that area with the help of some sprayers. With the sprayer used for the in gardening, we are using sprayers. We can use that sprayers for the purifying this area. And fungal infection case, I have explained in previous class. We should do external therapy. We should do a demoisturizing therapy. Why demoisturize? With this Tangana powder. Bongara, we can apply over that area along with the internal therapy. Ichthyosis case, I have explained. The rehydration therapy we can utilize after dipping that area, or after applying water or kashaya over that area. We should apply oil. Not apply oil before doing this kashaya application. In alopecia, we are doing initial kuttana or initial suji vedha over that area, and after that suji vedha, and after suji vedha we are applying leech over that area in order to do a anticoagulant therapy there. In vesiculobullous rashes, in vesicles and bullous lesions, we should drain the accumulated fluid in the vesicles or bullous. For that, we should do wet compression along with some lancet. With a lancet, you should perform a small prick under the bullous, and the fluid should be drained back. And over this area, we can do this wet compression also. Wet compression means simply put a kashaya, a cloth piece filled with, put in kashayas. Tripura kashaya, cloth piece dipped in tripura kashaya, we can apply over this area. So I think my time is over now. So many matters remaining. This is Kashaya Dhara. We just detailed previously. Initially, we are doing this Kashaya Dhara in all cases. Kashaya Dhara means anti-inflammatory and anti-pruritic agents will be mixed in Kashayas. Haridra, tulasi, like materials, tribala kashaya, and like that we can use in kashayas. With the kashaya, we are doing kashaya dhara. Okay. So I think let us stop here. If necessary, we will answer some parts. We will discuss further, and after that, if time allows, I will detail some more topical therapies. I think we can let us stop here and discuss. If you are having some doubts regarding this, you ask some questions, and while answering some questions, I will discuss the further parts.
Yes, sir. Yes,
Is it
sir.
okay?
Thank you. Yes, sir. That will be fine, sir. We can now move forward with the discussions. Doctors, you can put your questions in the chat box so that we can discuss. And during the discussion itself, sir can give us more glimpses on this further topical applications, I hope. So, sir, with that, we can move forward with the discussions. Sir, sir, there is you had explained about different topical applications may lead to Vyadivritti. So, sir, we need to judiciously select the topical application at different stages of the disease. So, there is another part we need to convince the patient for that, because many of the patients, as you said, they are coming for the topical application and give fast relief. So, how will we convince them, sir? So I think it is a major part during a treatment itself. Hello, sir.
Okay. Okay. Let me let me switch over to my webcam, sir.
Yes, sir. Yes, sir.
Okay.